So we have a couple of designations for patients who are in different situations. One of the first ones that we have here is we call it an OP3 patient. So for patients who no-show 2 times or have 4 excused absences within 6 months, we call these patients OP3 patients. It just helps us to understand, and you've gone through this scheduling mechanism, it just helps us to understand that these patients have the potential of not showing up. So when we look at uh, our schedule here, how do we tell if a patient has had a couple of no-shows? So I've created a couple of no-show appointment types here. And then all I need to do is when I go to the patient and I go onto the locate button, we'll see here that it has 2 tabs at the bottom, a past appointment and a current appointment. So if we go to the past appointment, we can count that they had 2 no-shows within the last 6 months. So this patient could be designated as an OP3 patient. So how do we put on the icon? We'll go to the edit patient screen, we'll go to alerts, and then we'll scroll down to OP3 patient and we'll add that alert. And then you'll see when we click OK that the icon shows up here. Sometimes it's this white icon with the hand. Sometimes it's a little, people call it a rabbit icon. So you'll see uh, one of those 2 designations. But again, if you hover over it, it's an OP3 patient. Okay. The other alert that we have is an OP4 patient. Now, an OP4 patient is someone who has been rude, demanding, is a drug seeker, or someone who creates unnecessary stress among staff. Okay. Now, a lot of times these patients will be designated as an OP4 patient back in the clinic, but there is a potential if you have been, if a patient is talking rude to you up the front, you want to talk with the provider, and you might set an OP4 status to that patient. OP4 patients will have this alert, and these patients are no longer contacted by the office, and they really need permission to be seen by the practice. So if an OP4 patient calls, put the patient on hold and talk with the doctor about scheduling that patient. Okay. Dismissed patients are patients who have threatened lawsuits, who are belligerently rude, who have sexually harassed anyone within the office, and they have been formally dismissed by the office. These patients are not allowed to be scheduled for an appointment, and any scheduling requests need to be alerted to the doctor, and then the doctor will call the patient and follow up with them. So again, the same mechanism to put on these alerts, going to just the edit patient screen, going to patient alerts, and you can add in the OP4 designation or the dismissed patient designation, and those corresponding icons will show up.